Okay, we're ready to go.
Good evening, everyone, and welcome to tonight's town hall on the Better Care, Better Jobs Act with Senator Bob Casey, our own senator here from Pennsylvania. My name is Patrick Keenan. I'm the policy director for the Pennsylvania Health Access Network, and I'm really pleased to be joined not only by Senator Casey, but also by a fantastic group of individuals, constituents, and those who both provide care under home and community-based services waivers and those that benefit from being able to live with dignity and independence in their own community based on these critical services. Senator Casey has a shortened time with us tonight because of an important vote that is coming up later in this hour. So it's really important that I can always, I'll be with you for the duration of tonight's event, so we can always talk more about specific Pennsylvania impacts, but it's really important to let the senator kind of share with us this monumental piece of legislation that really will have a transformative impact for folks if it were enacted. So I'm pleased at this point to introduce Kimberly and Julia, who will talk a little bit about their experiences with home and community-based services, and then turn it over to Senator Casey. Kimberly and Julia.
Hi, I'm Kim, and I live in Exton in Chester County. This is my daughter, Julia. Julia is 25 years old. Home and community-based services play a big role in our family's life. They allow our daughter, Julia, to flourish in the community, and because we know that she is getting great care during those hours that we are not home, they allow us to keep our jobs. Julia has autism and an intellectual disability. Julia started using home and community-based services after graduation from high school. She has always been outgoing and an active part in whatever community she is in. She participated in Special Olympics, Challenger sports, and various other programs. She was on her high school swim team. When she graduated from high school, she expected to continue participating in opportunities available to her as an adult. This is where home and community-based services come in. Julia has an aide 5 days a week, 3 hours a day. She helps Julia engage in the community. She takes her to the YMCA to swim 60 to 70 laps. Sometimes they go to local trails to walk. This helps provide excellent exercise. They shop for groceries and do errands together, helping Julia develop a range of important life skills. Julia does not drive, and public transportation isn't an option for her where we live. So having an aide is vital to Julia being able to leave the house and accomplish tasks she enjoys. Of all her activities, she enjoys her job at Wawa the most. She is a loyal, hardworking employee, and her supervisors and managers are happy to have her.
Having someone to help me in a community is very important to me. I need to exercise, grocery shop, go to appointments, and socialize to stay healthy and happy. My step Angela helps me and advocates for me. I really love working at Wawa. I work Tuesday, Thursday, and Friday from 2 to 6 p.m. My step Angela drops me off. I need her to drive me so I can go to work.
Because of her age, Julia is able to get to work. Once there, she is independent and has been a success at her job for 4 years. This is a great example of how home and community-based services are supposed to work and how they benefit Julia, my family, and our community. My youngest child, Ryan, also has autism and an intellectual disability. He will be graduating from high school soon. He's doing well in his transition program, learning life skills and job skills. When he graduates, he will need more support and supervision from home and community-based services for health and safety reasons. My husband and I worry that these services will not be available for him. That would be sad for Ryan and devastating to our family, as I would most likely have to leave my job to care for him. So the work that Senator Casey is doing now to secure funding for this program is important for my entire family. I am very glad to be here to support the senator's work. Next page.
Right here? I'm very glad to be here to support Sen. Casey, an important service that so many people in Pennsylvania rely on. And now we'll hear from the senator himself. Thanks again, ER.
Well, Julia, thanks very much. I want to thank you and I want to thank both of you, both you and Kim, for that presentation. I just noting as you were talking that my wife and I have 4 daughters, and our third daughter is Julia. And so I want to thank you for bringing your story and your voice to these issues. And I hope someday that we might be able to meet at Wawa, because when I'm on the road, I get to visit Wawa once in a while. So thank you for bringing your story. And I want to thank Patrick and the whole team at FAN for this opportunity, because the next number of weeks and months, really only maybe 3 months at the most, between now and say the end of September, not even 3, we're going to be making some decisions in the Senate that will have an impact on Americans for the next 50 years. And one of those major matters that we're going to address finally, after all these years of advocates and families urging us to do that, finally, we're going to be focused on home and community-based services for people with disabilities, for seniors, and also to lift up this great workforce that both Kim and Julia talked about in their presentation. What we're talking about here is President Biden has talked about the Build Back Better agenda. This bill that will be part of the debate and part of what we will vote on, the Better Care, Better Jobs bill, is really the ultimate better in the Build Back Better agenda of President Biden. It's better jobs, it's better care, and it's better support. Here's what that means. Better jobs for home care workers, the people who provide care and support for seniors and for people with disabilities. So there's no question about it, it's a better jobs bill. It's also better care for seniors and people with disabilities, the individuals who are the recipient, the beneficiary of those services. And thirdly, of course, it's better support for families, and better support in particular for family caregivers, tens of millions of them across the country. So it's really an investment in a great American idea, the idea that caregiving is part of who we are as a country. If we're going to say we're one family in America, if we're going to say we're the greatest country in the world, if we're going to say, as we often do, that we care deeply about older Americans, we care deeply about people with disabilities, and we care about the workforce that provides care and support and services for those Americans. If that's what we say and that's what we claim is part of our values in America, then we should have policy that matches that. So we got some work to do. We got to pass the Better Care, Better Jobs bill. And in the aftermath and also still in the grip of the pandemic, we've got to be concerned as well about getting people back to work. And we've heard a lot, as you all have, about the physical infrastructure legislation that we might even be voting on, should be voting on later today, but it'll take us a number of days to complete that work. But that legislation talks about fixing roads and bridges, and that's important. So for many Americans, fixing that bridge in their hometown is going to be important. But it's also critically important that that bridge to work isn't simply, for many Americans, a physical bridge. For a lot of Americans, the bridge to work will be home and community-based services, so that their mom or their dad can have care at home where they want to have care. That bridge to work might be support and services for a loved one in their family, a son or a daughter or someone else with a disability. That bridge to work might be quality, affordable childcare. So there are a lot of bridges on the way to work, and they're not all physical bridges. And I'm going to have to remind some people in Washington about that over the next couple of weeks. There's no question that there's an urgent need for a substantial investment in, and therefore a huge expansion of home and community-based services for seniors and people with disabilities. How do I know that? Well, I know that because there's a long waiting list. The most recent number for Americans waiting for home and community-based services is 820,000 Americans. They live in blue states and red states and purple states. They live all across the country. It doesn't matter where you are. Folks are on a waiting list. And there are a lot more Americans than 820,000 who may not technically be on the waiting list, but want these services and supports and hope they will have them for themselves or their families. So we've got a lot of work to do. We've got to fight against some powerful interests in Washington who don't want to make this investment. But we're going to fight them in this legislative battle, and we're going to win the battle because we're going to get this done. We're going to pass this legislation to once and for all address a problem that a lot of Americans have been talking about for years, and now we finally get to vote on. So we're grateful for the work that each of you are doing to get the message out about how important this is for caregiving, for job creation, and for getting people back to work. And it's most important, I think, as Americans, that we live up to our values as Americans, that we say that America is going to be the #1 country in the world for home and community-based services, the #1 country in the world for caregiving of all kinds. We're not going to settle for 3rd place or 5th place or 13th place. We want America to be #1 in caregiving and #1 in the quality services that we provide to seniors and people with disabilities. And one of the ways to do that, of course, in addition to focusing on those who need these services, is to make sure that the workforce, which is mostly women and mostly women of color making $12 an hour, that's not anywhere near an adequate wage for those who are doing this essential heroic work. So I'm grateful for the work that FAN is doing to help us get this done, and I look forward to the discussion. Thanks very much.
Senator Casey, thanks so much, and thanks again to Kimberly and Julia. We're going to have more folks talking about their experiences with home and community-based services, but while we have you, we do have a couple of questions that have come in from the chat. I'm going to remind folks before we get to the questions that in your participants list, you should see 2 folks identified as questions Joanna and questions Jesse. Please chat any questions that you have to them, and they will make sure that we get them into the queue for the Senator as long as we have Senator Casey here tonight. So the first question, Senator Casey, you mentioned a little bit about expanded eligibility criteria or new eligibility criteria for home and community-based services. Could you tell us a little bit more about how the Better Care, Better Jobs Act would do that and what that means for folks?
That's a great question. What we're trying to do is to continue really a policy that we just began. We just began to implement a new policy for home and community-based services in the rescue plan. As you all know, the rescue plan was about $1.9 trillion, almost $2 trillion, to accelerate greatly the number of Americans who could be vaccinated. And we've made great progress on that, still have more work to do. But now we have the resources for more vaccinations that we would not have if we didn't pass the rescue plan. We're trying to make a huge investment as we did in schools, but we also wanted to make an investment in people, whether it's children and families that needed help recovering from the pandemic. So we're trying to help them with the child tax credit, really a tax cut for families that would cut child poverty in half. And also we wanted to make an investment on food assistance. In addition to all of that, we wanted to make a down payment on home and community-based services. So the rescue plan had $12.7 billion that was available to the states as a Medicaid match for states to begin the work on home and community-based services. So what we're going to do is just continue that expansion of the rescue plan to make the investment that states will have available to them for more Medicaid money if they are willing to greatly expand the opportunity to have home and community-based services, and to put in strong standards for not just access to these services, but standards to lift up the workforce and provide the kind of care that every American who happens to be a senior or a person with a disability should have a right to expect. So we're gonna invite states to take advantage of a great opportunity, which they've never had before, to make these investments in a manner that's consistent with what people living in those states would expect. And I don't, as I mentioned before, I don't care whether you're talking about a red state or a blue state, a conservative state or a more liberal state. Americans want these services. They want to know that their family member is going to have the option to have care in the home or in a community-based setting. So it's really providing the dollars for Medicaid and the matching dollars that states need to build up, or in some cases to almost for the first time have in place, a strong system for home and community-based services.
Senator Casey, some of our participants tonight are folks who care for their loved one as a family member. Can you talk about some features of the bill that would affect family members as caregivers and how the act might help them?
Yeah, by providing these resources for states, states will have the opportunity to provide help to families so that you don't have a situation where a family member is prevented from going to work because they have a caregiving responsibility of a family member that they're not prepared for. Most caregivers are not prepared for that. Most family caregivers, I should say, are not prepared for that responsibility. They often were not trained, often have to leave the job they had to do caregiving because, of course, it's an act of love. They want to help a family member in their home, often a parent or someone else. It might be a sibling as well, and they're not prepared to do that, and they lose a lot of income when they provide that care. We need to help them, and the dollars that we're trying to get passed into law here will allow those families to have the opportunity to get back to work. In fact, when Harvard and MIT looked at our bill, the Better Care, Better Jobs bill, because we have a bill now, it's not theory, we've got a bill that they can examine as anyone can. We can get as many as 1.1 million family caregivers back to work because of this bill. We can also create additional jobs in addition to that 1.1 million. We can create 500,000 new caregiving jobs as a result of this bill. And thirdly, we can take the number of Americans who are receiving services now and double that number across the country so that millions of Americans can, for the first time, have access to home and community-based services.
Fantastic. Josie from Yardley just wants you to clarify a little bit more about how we can ensure, or sorry, Josie from Newcastle wants to know a little bit more about how we can ensure how the bill supports people with disabilities and caregivers so that they can work and not risk losing their services.
Well, we want to make sure that the eligibility is expanded in addition to the access. And that's going to be very important because we want to reach as many Americans as possible with this policy. We know there are a lot of families now, for example, in another caregiving context where sometimes, for example, when a senior would be at a point where they need skilled care, and they and their family may decide to have a senior go to live in a nursing home. The way our system works now is Medicaid supports that, but you don't have as much Medicaid support. You have, frankly, very limited support for the other option, the home and community-based option. And that's what we're trying to do. We're trying to expand the number or the opportunities for more and more Americans to have the same option that families have now. A lot of middle-class families, as you know, benefit greatly from Medicaid in the context of nursing home or what some might call congregate care settings. Those same middle-class families and lower income families should have the opportunity as well to have a caregiving option for their loved one in the home or in a community-based setting.
Great. Susan from Perry County wants to know a little bit more about thoughts about how we're going to pay for this. So this is a huge step forward. There's been a lot of talk about using Medicare and negotiating on drug prices. Do you have any thoughts about, like, what are some of the ways in which we can make sure that this program, that the Better Care, Better Jobs Act, if it's passed, is here, you know, not just for the immediate time, but for in a sustainable long-term way?
Yeah, as many of the folks who were part of this discussion today know, the president's proposal for home and community-based services is $400 billion. And if we're going to have a number, an investment that is of a dimension like that, several $100 billion of investment, we want to make sure that that can be paid for. Just as when we want to expand childcare or pre-kindergarten education for every 3- and 4-year-old, or other priorities for children and families and seniors and people with disabilities. As I said, we're going to be doing things that have not been done in 75 years. But as we're doing that, we want to pay for it and offset it. So that might mean that large corporations have to pay more to invest in these priorities. But we're not at the point yet where we have an agreement on the pay for it. So that's going to take a while, and that will take, we probably won't have an agreement on that till sometime in early September. But that's the intent here, is to make sure that as we make these investments, we do everything possible to offset it by using the tax code or other pathways to paying for it. These are priorities that are important enough not just to enact into law, but also to pay for it.
Thank you. I know we're just about out of time because I know you're expected to go back to the floor for a vote. So this is the perfect question to kind of wrap up on. Amy from Yardley is asking, can you tell us a little bit more about how individuals can advocate for the Better Care, Better Jobs Act? And I'll add into this, what do we need to be doing right now? Why is this important for us to get done now? And how can we, you know, all of us as constituents here in Pennsylvania support you in advancing this piece of legislation?
I would say make your case to your member of Congress. You're in the House of Representatives and both your senators. I'm one of them. But the opportunities we have today, as you all know, to advocate for a policy is not limited to your state. You can make your case to any senator, any member of the House, because of social media and other ways of reaching senators and House members of both parties. So I think most people listening to my voice know how to do that. So I would say more of that, as much as you can do, because we're at a point now where we're really on the threshold of investments, and I'll say it again, that have not been made in 75 years since the New Deal. And they have the potential to transform in a very positive way the lives of tens of millions of families. And that's why we have limited time to do it, and it's not a window or an opportunity we're going to have every year. So we got to get it done, not just this year, but in the next, really between, say, August 1st and maybe sometime by the end of September. So even less than 3 months to get all this done. But I think most people know how to make their case. But I think probably the best way to do that is not simply arguing the policy. It's telling your story, or telling the story relating the story of someone you know. It could be a loved one, a relative, a friend, or a neighbor. That's why Julia telling her story about what home and community-based services means to her, that allows her to work and gives her mom, I guess, some peace of mind knowing that she has those opportunities. So the stories are what connect to people across the country and have the most impact on legislators. But I'm grateful people are willing to engage on this.
Senator Casey, we're so glad to have you tonight. Thank you for the time. We do have some time for questions later on. We know that some of your folks may be able to help us navigate some of those in your absence. I just want to say this, you've been a great representative for the people in Washington, and we're so fortunate to have you. I think sometimes we may take your advocacy and your presence for granted. I just want to point out that whenever we talk to any national advocates or other groups across the country, everyone is always saying how strong of an advocate you are for Medicaid, the amazing work that you and your entire team have been doing, in really difficult times under the previous administration, but really for so many years, not just on behalf of those on Medicaid here in Pennsylvania, but really for the life of Medicaid as a program that really has gotten us through this pandemic. So thank you so much for your leadership on this bill. We're very excited to see it move forward. And you couldn't have done a better intro to some of our other speakers that we're going to have tonight who will be doing that and sharing their story. So thank you again.
Patrick, I couldn't do any of that. Saving Medicaid as we've been doing the last couple of years, and then now wanting to expand it to provide better services for home and community-based services. Couldn't do without the work of FAN. So thanks so much.
Thank you, Senator. So we have many folks who have joined us tonight. I hope you don't leave, although Senator Casey does have to get to the floor for a vote, because it is important, just as Senator Casey said, we do have more individuals, just two more individuals who are going to share their experiences with home and community-based services. I'm going to keep you all on the hook, though, because we have some very important and exciting Pennsylvania numbers. But I feel like if we share them right now, we may have more drop-off. So before that happens, I want to turn it over to Lolita Owens. Lolita is a home healthcare worker from Philadelphia. She's a member of SEIU Healthcare Pennsylvania. She's joined us to share her perspective on the benefits of home and community-based services and to tell us a little bit more about the difference that she makes in the lives of those that she works with. So Lolita.
I had to take myself off of mute. I'm sorry about that. Can you guys hear me?
Loud and clear. Thanks so much, Lolita.
Okay. Just want to say thank you, Senator Casey, for being on this call. As a home care workers are the foundation of healthcare. And like I said, my name is Lolita Owens. I live in Philadelphia, Pennsylvania. I've been a home care aide off and on for about 18, 19 years. As a home care worker on the front lines of the pandemic, helping people stay safe and cared for. It is important that we have a real voice in the industry to keep us safe too. I am a proud member of SEIU Healthcare of PA. We are the state's largest healthcare union, representing over 40,000 nursing home care, and hospital workers, united to fight for dignity and respect for healthcare workers and for those we care for. I want to thank you, Senator Casey, for supporting the Better Care, Better Jobs Act in the Senate, for leadership to secure the $4 billion of funding that President Biden knows is necessary to Americans' healthcare infrastructure. I have worked as a home care worker, like I said, for so many years, and the work is essential to help people stay out of nursing homes, even hospitals as well too. Because they want to be in their home. They want to live safely and get quality care in their homes. People are able to live in their homes and communities where they know their neighbors are. They want to stay safe as well. Whatever disease has taken their body, it has not taken their mind. They want to be a part of their communities and their families' lives as well. Our consumers and their families need dedicated workers who can rely on to make that possible. Home care workers are the foundation, once again, of healthcare. I see some consumers 5 to 7 days a week. I see their moods, their improvement when I walk through their doors. I provide stability and quality of care to their lives. Our consumers range in ability from partially mobile to entirely bedbound. I operate the mechanicals they need to be active. I know their social and medical routines to feed, to cook, like cleaning, help consumers move around the home, take and run errands, socialize with their neighbors. I make their care plans. Doctors and consumers can consistently and have quality, high quality care. My consumer has MS and diabetes. She has type 2 diabetes. She's bedbound, she's half blind, and she has incognito issues. And I know on a day-to-day basis, when I walk through the door, she calls me Lola. My Lola's here, she's on time. I knew she would be here for me because she depends on me to be here for her. The communication for her that I have is with her doctors and all of the rest of the care team that takes care of her, and I can address any issues for her on her behalf because I take the time to know my consumer, know what she needs to have. For Biden to have worked hard to get this $4 billion in funding that will help workers try not to live from paycheck to paycheck. It will bring jobs to communities, especially the African-American women. Better jobs will reduce turnover, which will directly help consumers who will be able to build professional relationship with the people who help them live safe and healthy lives. Home care workers, once again, are the foundation of healthcare, and we need the funding to do our jobs as well because we never know when we ourselves may need the care ourselves in our home. So we definitely need to have the Better Care, Better Jobs Act to be passed and everything. We need it.
Olita, thank you so much. I think you said home care is the foundation. I just want to say firsthand, thank you to you and all of the folks that have been giving care throughout the pandemic. We know it's taken a hard toll. We know that the caregivers have lost, their lives and loved ones due to the pandemic, but have really been on the front lines. And I just extend a heartfelt, thank you to you all. I have my own aunt who relies on home and community-based services to live with independence and dignity and see the impact of, the caregivers that are coming into our home are they're really family. They're our family. When we go there, they're just like other family members. So thank you for everything you're doing. As I mentioned, we still have the opportunity if folks have questions about the bill. We do have time for questions. Please keep on sending them to the 2 questions accounts in your chat. We will try to address them if we can. We have a little bit of time towards the end of this, but also we have some Pennsylvania specific numbers that I'm excited to share in just a second. With that, I'm going to move us to our last speaker tonight, Tammy. Tammy is a consumer from Sunbury. She's here to tell us how home and community-based services add to her life. Tammy?
Hey, Tammy, it's Robin. You may be muted. You want to try *6? If you're trying, just to see if we can fix it. Hold on.
Robin, we may need to be.
Yeah, no, I think she's good now.
It's unmuted.
Okay, thanks,
Perfect.
Tam. Go ahead.
Okay. My name is Tammy. I am 60 years old. I live in Sunbury, and I am totally blind. I also experience anxiety and depression. I am proud to live independently for the most part. I am able to do chores around the house, and my home has always passed inspections. I am also grateful that I have access to home and community-based services. I receive a home care aide for 3 hours a week. She helps me with some issues that like bathing. She also helps me with cleaning in my house in ways that are very difficult for me to do. Well, she washes dishes, mops floors, does some dusting, and makes sure that the jobs are done well. Having clean floors and a clean kitchen and bathroom are health issues. Feeling that my home is clean and safe is a load off my mind. My paper right. I would like to increase the hours that I receive with my home health care aide like having help with cooking, which can be a dangerous activity. I would like to be able to get some exercise by walking outside, which would be much easier with an aide. I would like to get help to and from medical appointments. An aide would make sure that drivers from the transportation that I use could find me in office buildings after appointments. That would let me get home safely and on time and reduce my anxiety. When my aide is in my home, my depression and anxiety are less of a problem. The one-to-one contact with my aide allows me to reduce what I can do and reduce what I can't do. And I would like to thank Senator Casey for his work on home and community-based services. I hope that other lawmakers join him in this fight so that more people can live safely with dignity they deserve. And that's it. I'm sorry I didn't do too good.
Tammy, you did absolutely wonderful. Thank you, and I mean that because it's a lot to talk about your experiences and share them with folks today. So thank you for doing it, and please thank you for speaking up. We heard it directly from Senator Casey. We need more voices like you sharing their stories. So thank you. I'm going to, so I've been hinting, so keep your questions coming in. What we will do, we won't have time, given the constraints in today's event, to go through all of them, but what we will do is try to take those cases or questions and see if we can get answers and more details for you if we weren't able to answer them live. So a couple of things I want to share about the Better Care, Better Jobs Act here in Pennsylvania. We've heard the word monumental and historic used to describe this. I can't underscore it enough. The first thing that we know about the act here in Pennsylvania is that the 16,000 person wait list for the Office of Developmental Programs Home and Community-Based Services waiver would be eliminated. That's 16,000 people who have literally been for many cases, for an exceedingly long time, waiting for these life-saving, life-giving services that haven't been able to get them. So there's the first thing that we would see as a result. Second thing is we've heard so much about family caregivers. They would be provided with respite care, training and information about critical events such as emergencies, infection control, and access to personal protective equipment. We know that, quickly many folks had to pivot on the front lines of this pandemic, and so that's another important part. We heard a little bit about expanding the eligibility. This means that we would actually be able to raise the income limits for home and community-based services. This alone would make 33,000 Pennsylvanians eligible for home and community-based services. Again, absolutely life-saving. Personal care services would be available for all eligible Pennsylvanians, meaning an additional 87,000 people would be able to receive personal care services. Now, we've heard this all sounds a lot about the better care part, but as Senator Casey already mentioned, this is about better jobs as well. Almost 20,000 caregiving jobs would be created here in Pennsylvania. 20,000 new folks, in addition to Lolita and others that will be able to give care for this expanded group of folks. And because of that, over 40,000 family caregivers would be able to return to or look for work, again, improving the economic health of their families. This is truly transformational in so many different ways. So I think it's really important that we speak up and talk, as Senator Casey said, to other senators, including our other senator from Pennsylvania, as well as our members of the Pennsylvania House of Representatives delegation to ensure that we secure passage of the Better Care, Better Jobs Act. Now, we have two more questions that we can get to. I believe we have Michael and Narda from Senator Casey's staff who might be able to help us with these questions. Michael and Narda, are you still here and able to unmute yourselves?
Hi, this is Narda from Senator Casey's office.
Great, thank you. And we're asking, I think, trying to do the technology to also unmute Michael. There we go. Great. So Michael and Narda, the first question. So some of the folks who are on here who are home care workers today are concerned about the pay raises and what other employers are able to pay $15 an hour, where many direct care workers are making $10 to $12 an hour. Can you talk a little bit about how this would impact the workforce? This question comes from Natalia from Schuylkill County.
Yeah, and Narda, jump in here too. I can talk about the two goals of this bill, and also it is really built on the president's plan that he announced in March. The one was to expand home and community-based services, but the other was to increase the compensation for the workforce overall. So the bill allows for, actually doesn't allow for, I apologize, it requires states to actually update their Medicaid reimbursement rates every 2 years. And it has to link those reimbursement rates so that agencies can pay the workforce at a fair wage comparable to other careers that are comparable to home care services. So that's a requirement of the bill. And the state will actually have to create a plan of how they will increase the compensation. And when I say compensation, it's not just wages, it's also the availability of benefits as well. And in that plan, workers, family members, people with disabilities, older adults, they have the right to actually weigh in on what that plan is going to look like and how the state is actually going to increase that compensation. So a core component of this is absolutely that we can expand services without having people to actually do this critical work like Lolita. The only way that we recruit people and we secure people and we make sure the turnover rate decreases is if we increase the hourly wage and the benefit structure that's there. So as Patrick has said, $400 billion is historic. Major portions of that increase has to go to directly to the workforce.
Thank you. Michael, one last question tonight. We've had a lot of Pennsylvania state-specific questions that may not specifically tie into the bill provisions, things like for Office of Developmental Program waivers around a 14-hour rule or a 40-60 rule about how waivers can pay for people. But one of the things I noticed, those questions come from Kathleen, one of the things I noticed that's a provision in the law is for states to have a plan to innovate, and hopefully that would mean that advocates like Kathleen could, kind of address some of these problems with the current waiver rules, directly with the state, and perhaps the state could pursue through the innovation components of the Better Care, Better Jobs Act, some changes that would improve situations for caregivers like Kathleen. Can you talk a little bit about how states might be able to innovate if the Better Care, Better Jobs Act were passed?
Yeah, that's exactly, you did a really good job, Patrick, of explaining that. Senator Casey felt very strongly, and the other senators' offices that we worked with felt strongly that we can't just go about doing the same thing that we've been doing. A lot of state rate setting happens not in the dark or in a back room, but it isn't really transparent. And the senator felt we have to bring that out into the open. We have to make sure that the people who are helping to set those rates and the policies, the innovative policies, not just the rates, are the people who are actually being affected by this. So that's why there is this state planning process that has to include all of the stakeholders in this. And that means workers, folks who represent workers, family members, individuals themselves who are receiving these services. And we left it flexible on purpose so that those stakeholders can help the state create the plan that fits them the best. So the type of concerns that Kathleen is talking about could be addressed in the planning process. New Hampshire may have something different, Nevada may have something else that they want to focus on. We left it flexible so that you can address current problems and also really look to the future to innovate. That was actually by design to do that. We do get some criticism that we're not really demonstrative about what absolutely has to take place. Our fear there is if we're too demonstrative, what happens is states won't participate and then people won't get the benefits. The two places or the three places where where the senator's been very demonstrative about this is that the eligibility level has to increase to 300% of poverty. That will, as Patrick said, that will increase the number of people eligible in Pennsylvania. That the state has to offer personal care attendant services, and that respite care has to be offered for family members. Those are givens that are requirements. And then the state can build on those as a foundation for other innovative approaches as well.
Great. Well, as we mentioned, all the other questions, we're just about at time. So I'm going to, again, we will do our best to be able to get those back to you and your team. Again, thank you for all the efforts that Senator Casey has put forward, and we really want to thank all of our speakers tonight. As Senator Casey said, we need action, and so the person who's always here to talk about action and who will actually close us out tonight is Robin Stelly. So I'm pleased to turn it over to Robin so she can tell us about some of the next steps that we can take to make sure that this historic law becomes, or act proposal becomes law, and that we can actually see all of these great benefits that have been highlighted tonight. Robin?
Hi, thank you very much for being here today and for spending an hour with us talking about this important program and this important legislation. And Senator Casey said we can win. He said we can get this done, but we absolutely positively need to raise up our voices. So we need to call our federal representatives. And I know Senator Casey's a senator, but this is going to have to be approved by the Senate and the House. So we had 100 and something people register for this. We had 59 people here at the highest point. So you're all going to get an email that's going to remind you to call your federal rep and let them know that you want them to vote for the money that's going to fund an expansion of home and community-based services. And we're going to provide the language there for you in that follow-up email. But this call is incredibly important. They don't know that people care about this. And what we all say at FAN is, if you live long enough and you're not a millionaire, you're going to need these services. And if that's a selfish motive, but that's okay. You should be planning for your future. And Senator Casey said something else very interesting tonight when he said they are making decisions now that are going to impact us for the next 50 years, at least 50 years. Remember, Medicaid was passed about 56 years ago. Okay, so they made that decision and people are benefiting from it now. We need to take the advantage of this time right now, this moment, to get this passed, to get this funding passed. And the only way it's going to happen is if we lift up our voices, and people all around the country do. We only control Pennsylvania. So please pay attention when you get the email. Make the call to your federal rep. That's your U.S. member of Congress, your congresswoman, congressman, and you can use the tiny little script we're going to include for you. Thank you so much. We are done. Unless Patrick has anything else to say, I'm going to end the meeting with my thanks again to everyone for being here. And thank you to all FAN staff for helping out. Thank you to the Senator and Michael and Narda, and have a great night, everybody. Thank you very much.